My name is Kendall Falk, and I go to the Bellray Institute for Veterinary Technicians. Today, I'm going to tell you about an important virus of cats called the feline immunodeficiency virus, FIV. FIV is mainly a retrovirus that attacks and weakens the immune system of cats. The good news is that humans can't get FIV, but the bad news is that cats can, and they can spread it to each other. Primarily, outdoor cats are at risk.
One of the things you need to know about FIV is how it's spread. In 1986, the virus was discovered in California, and it was transmitted from cat to cat primarily by bites, as it's shed in the saliva. However, intimate contact through grooming or sharing food does not spread the virus. This disease is found worldwide, and it preferentially infects white blood cells, which are very important to the cat's immune system. The virus disables or destroys the white blood cells and leaves the cat susceptible to infections. Once your cat is infected with FIV, it is infected for life and can transmit the virus if it bites another cat. One of the other things that's important to know is how FIV is caused. Well, FIV is caused by a retrovirus called the lentivirus. It's similar to the retrovirus that causes feline leukemia virus in cats, and it causes similar symptoms, particularly suppression of the immune system. It is also very similar to the human AIDS virus and is sometimes referred to as cat AIDS or feline AIDS. However, there is no evidence that people can get AIDS from a cat that has FIV. FIV can also be passed from mothers to kittens as well. There are many clinical signs associated with FIV. Some of them include lymphadenopathy, anemia, ocular lesions, gingivitis, weight loss, and behavior abnormality. This virus has 3 stages. The first one, being the acute stage, occurs approximately 4 to 6 weeks after infection. It may manifest as, but is not limited to, a fever, swollen lymph nodes, a low white cell count, or any combination of the above. Most cats survive this phase without treatment. The second phase, the subclinical stage, is a period of relative normalcy lasting months to years. And finally, the chronic clinical stage, the third one, results from a progressive destruction of the white blood cells and dysfunction of the immune system. Usually with pathognomonic signs, you will mostly see gingivitis or some kind of oral problem in the cat. What about diagnosis? Well, blood tests are available for screening for FIV in-house or at most labs. The most commonly used test is the ELISA test, which looks for viral antibodies in the blood. As for treatment, unfortunately there is no medication that will kill this virus. Treatment is aimed at keeping the immune system as strong as possible and utilizing medication as needed. Fortunately, the disease progresses slowly, and cats can remain healthy for several years after being positively diagnosed. What about a vaccine, you wonder? Well, there is a vaccine available for FIV, although it is not 100% effective in preventing the infection. The FIV virus will not survive long in the environment. Still, keeping your cat's environment clean and routinely using bleach to disinfect feeding bowls and other things makes sense. Only introduce new kittens into your household if they are healthy, free of internal or external parasites, and are current on their vaccines. The best method of preventing FIV is to prevent exposure in the first place. For more information on the feline immunodeficiency virus, you can check out the links below or contact your local veterinarian. This has been an educational video on the feline AIDS virus, or otherwise known as FIV.